Cymbalta can help. Cymbalta is a prescription medication that treats many symptoms of depression. Tell your doctor right away if your depression worsens or you have unusual changes in mood or behavior.
Numerous medications that help those with a mental illness rebalance and stabilize their brain chemistry have become the mainstay of mental health treatment. These prescription drugs, including antipsychotics, antidepressants, mood stabilizers, and anti-anxiety drugs, also affect the same neurotransmitters destabilized by street drugs. An example of psych meds is the class of antidepressants called SSRIs, or selective serotonin reuptake inhibitors. These medications include Celexa, Prozac, and Zoloft. They affect the neurotransmitter serotonin, which is involved with feelings of emotional well-being. It is thought that SSRIs increase the amount of serotonin available to adjacent cells. Over time, this sensitizes the receptor sites for serotonin, thus reducing depression.
The Celexa took about probably 2 months before I really noticed any difference. And then every time they'd increase the dose, it would take a week or two.
Well, none of the medicines that work for mental illness work right away. They take weeks or months to change the receptor density and the method with which receptors and neurotransmitters interact.
It took about a month and a half, but they had to get it balanced because of my diagnosis.
Attempts by mentally ill substance abusers to rapidly change their negative mood states through drug use can provide some short-term relief, but the resulting chemical imbalance makes them particularly vulnerable to reemergence of their mental illness.
Not emotionally stable at all. Everything inside me was chaotic. That's how it affected me, just chaotic.
The major differences between drugs and medications are that most psych meds are non-addicting and they are slower acting than alcohol or street drugs.
Be very careful what you call a drug and what you call a medication. Call medications like fluoxetine or antipsychotics or things like that. Call those medications. Call cocaine and meth drugs or drugs of abuse. Never call a medication a drug or a drug a self-medication.
I self-medicated with illegal drugs that did not help me and made everything all, worse. And so that's why I say, why not try, going with what a doctor prescribes me and see if it can help me.
When they use the word self-medication and you agree with that, what you're basically telling them is, oh yeah, your cocaine's a medication and my antipsychotic's a medication.
For those with mental illness, the abuse of drugs is most always followed by an increase in the severity of symptoms.
And when I was using, my depression was worse. I know that for a fact, being dope sick, waking up, thinking that life was over. I don't want to open my eye. Please, God, let me sleep a few more seconds so I don't have to deal with this.